Ready.
Heart anatomy for Masha. Okay. Looking at the frontal view, we notice the apex of the left ventricle, and then we would know that if we go up here, this would be the auricle of the atrium on the left side, and then to this side would be the right ventricle, and if we come up, we'd have the right auricle of the right atrium. And we can see from this external view the pulmonary trunk as it passes beneath the arch of the aorta, where we've had the ascending aorta, the arch of the aorta, and start into the descending aorta. As we take and open this up in coronal section, we are witnessing with its thick wall the left ventricle, and with its thin wall we're going to take and have the right ventricle, and we see that the wall of the left ventricle is making the midventricular septum. As we take and look above the area of the ventricle, we see this exit point for the blood from the left ventricle into the beginning of the aorta, and the valve there would be the aortic semilunar valves, and we would take and note that on the other side we take and see the further vessels or the valve flaps, and we see the opening for the coronary arteries bilaterally, remembering that there are two major coronary arteries that form a ring around the top of the heart like a crown. And then we'll take and proceed into this companion right ventricle. We look up at that opening and we see the bottom of the pulmonary semilunar valves positioned there. And then we look into the ventricles and we see the flaps have chordae tendineae, and they're anchored into the wall of the ventricle with the papillary muscle. And we see this very unique trabecular carne that takes and prevents the overstretching of those respective vessels or the respective chambers. And then we'll take and look at the four major vessels again. We've already remarked upon the pulmonary trunk, the aorta, but let's take and find the superior vena cava and the inferior vena cava that are returning venous blood from respectively above the level of the heart and below the level of the heart. And then let's take and find the pulmonary arteries that the pulmonary trunk splits up into. So we're going to have a left pulmonary artery, and over on the other side we'll see that we'll have a right pulmonary artery. And then let's take and find the four pulmonary veins, and so we go back to the apex side, so that makes that the left ventricle, so that makes these the left pulmonary veins. And then on the other side we would have the corresponding right pulmonary veins. These four are entering that left atrium, bringing oxygenated blood, highly colored, in veins. We're going into the lungs in the pulmonary trunk and respective right and left pulmonary arteries. It would have been lowered oxygen blood. It would have been the darker color, that one reverse that we have to be considerate of. Off the arch of the aorta, we see our first branch is the brachiocephalic trunk, and it will shortly branch into the right common carotid and the right subclavian artery. A direct branch off the arch, the second branch, is the other carotid, the left common carotid, and the third branch is the left subclavian. So we have two of these coming up through the neck to supply the head area, and these are going to supply the upper extremities. Here is a ligamentum arteriosum that we can take and see, and that was a remnant of fetal circulation.
Good.